Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Welcome. I'm glad you've joined us. We're going to talk about a problem that many of you have. Others might be experienced with it. You might have loved ones or know someone that might want to tune in tonight. We're going to be talking about pain, mainly people that have pain for long periods of time. We call that chronic pain. With us this evening, we've had a guest who's been with us before, Dr. Dennis Ford. He's well experienced and qualified to this. He actually sees patients every day with chronic pain. He's going to share his expertise with us and answer your questions. I talked to Dr. Ford off camera. He's not going to send any bills. He's just going to give good, honest care for you, answer your questions, help move you in the right direction. But more than that, we want everyone to know that the right direction is also thinking about our health in a global spiritual perspective. You know, God is our ultimate healer, and we all want to encourage people to find that relationship with their Creator. Now, how do you get in contact with us? Well, one way is to give us a call, 855-644-3278. But last time we tried a new way called texting. And I was really surprised that people texted. But if you're a texter, as many people are, you can text us. And our text number is 423-834-7307. And actually, when you text me, Michael Bell has fixed up this device right in front of me. I just hit this and I can see your text, and we can get that over to Dr. Ford, and he's going to answer your question. Right now, we're about the only live television program that's brave enough to answer people's questions live on air. We don't screen the questions other than when you call in. We don't have this scripted. So we're just glad that you are part of the program, because when you have a question, someone else might have that same question. So you actually help other people when you ask a question. Dr. Ford's going to be introduced after this break. We're waiting for your questions. We're going to be talking about chronic pain and also a little bit about aging as we continue. So thanks for joining us on Heart of Health Live.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. Would you like to experience better physical and mental health? Then consider volunteering in your community. Studies have shown that youth who give of their time to help others perform better in school, have greater self-confidence, and are more likely to become leaders in society than those who do not. And amongst adults, those who volunteer experience better physical and mental health, lower rates of disability while maintaining their autonomy as they age. And amazingly, these benefits persisted even after taking into account baseline limitations, socioeconomic status, health status, employment, exercise, smoking, and marital status. When we volunteer to help others, we activate the brain's love circuits, which calm the brain's fear circuits, reducing inflammation, thereby reducing physical and mental illness. To be smart requires a healthy brain, so be smart, live to give.
To learn more about mental health, visit comeandreason.com.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't, because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Our phone number, once again, 855-644-3278, or you can text us. Our text is 423-834-7307. Dr. Ford, thank you for joining us. You're wearing a beautiful color red.
Thank you for having me.
You know, my son likes, did you ever see Les Miserables? You know,
Yes.
red, the color, you know, that sort of brings me when I see the word red. So what got you interested in pain medications?
First,
pain treatment?
I had pain myself,
Okay.
and neck pain down my arm, and I found out it was a herniated disc, 2 herniated discs, and I was miserable for several months. Mm-hmm. And so I saw what people experience that are in pain. And I went through several different types of treatments, and fortunately, the last 16 years, I've been pain-free.
Well, that's great. That's great. So you didn't necessarily start off wanting to specialize in pain per se.
I was an anesthesiologist, so we treated acute
Right.
pain more so, and then it just kind of broadened out. No, I didn't, to answer
know,
the question.
And years ago, that wasn't really a subspecialty in medicine.
That's right.
But now I think it's heading that way. It's going to be a specialty training someday.
In fact, it is. They do.
Okay.
There's a fellowship for it
Okay.
in several different areas, anesthesiology and several other areas.
So you can specialize just treating chronic pain.
Yes.
So let's say a person comes to you, is referred. Usually, I guess you get your patients from referral from other physicians.
Yes.
And I assume that the physicians say, listen, we don't know what's causing the pain, so I'm going to send them to Dr. Ford to help manage the pain. And what's your approach to patients with chronic pain?
Well, a lot of times they do know what the pain is causing, but if they
Okay.
don't, then we will work it up. But history, physical exam, and radiology studies from X-rays to MRIs to see where the pain's coming from.
Okay, now, what is really, we've talked about chronic pain, but what's your definition of chronic pain?
The definition by the American Academy of Pain is chronic pain greater than 2 to 3 months. It's
Okay.
constant pain. That's basically the definition.
Okay. Now we know that pain, for me, I'm a heart doctor, pain is not good for the heart because it makes adrenaline, it makes inflammatory markers. Once you get a pain patient, what are some of the things you do to help them alleviate the pain?
We like to try different things such as physical therapy, chiropractic therapy, possibly acupuncture, some simple things to get them more mobile, exercising more. And then if they're not better, then we do different types of blocks.
Okay.
And then if necessary, pain medicines.
Okay. So pains come from nerves, right?
Yes.
And a block is where you just sort of numb that nerve, right?
Yes.
Okay. Now, in my book that I wrote, Medicines That Kill, one of the leading medicines that's given in the United States are narcotics. And we see every day of people getting addicted to narcotics. A lot of times they get addicted for chronic pain. So you don't reach for narcotics the first time you see a patient, do you?
No.
Okay.
But a lot of times by the time they get to me, they're probably on them. But,
Okay,
but
right.
I try not to do that. I love it when a patient wants to do other things to try to get the pain to go away without wanting narcotics.
Now, how can you really tell if someone might be addicted to narcotics and maybe not even have chronic pain or pain that bad and just coming to you because they want to get narcotics or a prescription refilled? How can you really tell?
It's sometimes tough to tell.
Okay.
But you try to get a good history, and we do urine drug screens,
Okay.
and you try to figure out where the pain is coming from, and you want to believe the patient because sometimes they may have a problem such as fibromyalgia or some pain that's hard to. There's not a test for it specifically except for an exam, and so you want to trust the patient as much as you can, but you try to use good judgment the best you can also.
Now, let's say someone's on medicines and you did everything else and they still have chronic pain. you put them on some narcotics. And what are some of the principles you use to help people take narcotics safely? Because everyone knows, they can decrease respiratory drive, they can slow down your bowels, lots of complications, and they can be addictive. You take more and more and more. What are some of the things that you do to sort of help people maybe not be more safe with these medicines?
I try to use other complementary medicines that are narcotics, such as there's several different medicines. I don't know if you mean to mention.
You can go ahead. Yeah.
There's Lyrica, Cymbalta. There's different medicines that are non-narcotics that we try to use to help decrease pain also. And then maybe if they're still having significant pain, we may add. I try to go low dose pain medicine. But there again, if there's a herniated disc or a different kind of pain problem, it can be helped with a block. We do that. And if they've had back surgery and they still are in a lot of pain, we may consider something like a spinal stimulator, electrical therapy.
And what is that?
It's where we do a trial where we put a spinal stimulator lead in the epidural space. And if it's a neck problem, we'll have a neck pain covering down the arm or back down the leg, and it's electrical therapy overriding the pain.
Oh, I see.
It's like a Tingen, only about 1,000 times better, patients tell me. And Tingen's another thing we use to help with pain management too. We like anything electrical that can help with not addicting, no harmful side effects.
Yeah. Now, there's been other people on our program that chiropractors, for instance, they try to take pressure off nerves.
Yes.
All sorts of different ways. Is this something that a pain management would also do?
I always get that history to see if they tried it. By the time they've come to me, a lot of times they have tried that.
And it didn't work.
And it may not have worked. Another thing I always like, there's a thing I highly recommend, and it's an inversion table. I have one in my house.
Okay.
You hang it, and they're not very expensive. You can hang at a 45-degree angle. You can hang on the web. And maybe 5, 10 minutes, 15 minutes a day, it's a natural decompression.
Okay.
Actually, a poor man's decompression table is the way I put it, and I have one in my house. The reason I say poor man's is because the regular decompression tables are $100,000 more in the doctor's offices.
Wow.
And it's another therapy that I use it as often as I can to help my neck, back, hips, joints, and things like that.
It takes pressure off.
It takes pressure. It's a natural anti-aging principle type of thing.
Now, what are the most common, I guess back would be the most common source of chronic pain?
Most common reason a patient sees a doctor.
Okay.
Back pain.
Is there any other types of pains that you see fairly often, or is it mainly back pain?
Oh, neck pain also.
Okay.
And joint pains, arthritis pains, rheumatoid, mostly osteoarthritis. Just lots of, that's the most common pain.
And I assume in your practice it's all ages, or is it mainly when you get older, or is it
more older? But I'm seeing younger. I really try to discourage younger people getting on pain medicine if at all possible.
Good. So I'm just glad you take a multidisciplinary approach. Now, I like to talk about people's brains. Do you ever do cognitive therapy to help pain?
I refer that out.
Okay. So did you think? Have you seen some benefits of that, or?
Yes, to some extent.
I've heard different things.
To some extent.
Of course, the theory is if you can decrease the adrenaline and inflammation by the way people think, and laughter, for instance, and deep breathing, for instance, and focusing on other things other than the pain, sometimes it can override it.
And I've had patients. I had one patient who was a minister, and he told me when he was up preaching, his pain went down. If they get involved and do things, their mind becomes distracted. Psychiatrists tell us if a pain score of 5, 1 to 10 is the pain scale, 10 is the worst and 1 is the least. Say if you have an average of pain score of 5, say if you're depressed, pain score, the brain may ramp it up to 7 or 8. Or if you're not, or anxiety, if you have minimal depression or less anxiety, pain may go down. So the brain plays with the pain too.
Yeah. So it sounds like treating chronic pain is pretty complex.
It is.
And I know a lot of people are going to call us tonight, 855-644-3278. We're on with Dr. Dennis Ford. Sometimes we don't have the answers, but we're willing to give an opinion and listen to you. We're going to come back in a few moments, and we're going to talk a little bit about aging. Aging is everyone's interested in aging. No one wants to get older, so we're going to talk about some things that are out there as far as aging, the common sense things like drinking more water, exercising, eating a healthy diet. But there's also some newer stuff that Dr. Ford's been using out there. We're going to talk to that after the break. Also, we're going to start, the questions are starting to come in. I don't have any on my text, which is 423-834-7307, but I can see the calls are starting to come in. You have plenty of time to talk to Dr. Ford. I think you've seen now that Dr. Ford just doesn't throw a narcotic at you. He looks at the whole system, from the brain to the nutrition to what's causing the pain. We're going to be right back after this break on Heart of Health Live.
Heart of Health Live will return in just a moment.
Heartwise Ministries and these adorable sheep want to remind you that every Thursday at 6 p.m. Eastern, the Heart of Health Live is all new with an exciting guest. That's 6 p.m. right here on this station.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartwiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, and your calls have been coming in for Dr. Ford, so we're going to start getting at these as quick as we can. We got at least 4 or 5 questions to cover in this segment, and one question is going to answer questions that many people might have. So we might have to hold off on aging just till we get some of these questions asked. The first one is from Chelsea. Dr. Ford. She's 27 years old. She's had 2 emergency cesarean sections. So emergencies, so that means something must have been gone. And after these, she's had bad back pain. Okay, where would you start in managing this pain? Where would you start for this? 27-year-old, I guess they don't have a diagnosis yet.
Okay. I probably would do a history and then see how long it's been going on. It sounds like it just started. I probably would get a minimum of an x-ray to look at her back and see what it looks like and see if there's a history of radicular pain down her leg. Okay. If it was, then you might consider an MRI, depending on how things are. But I'd probably hold off from that. She sounds like she might need some core strengthening, abdominal exercises back to strengthen her core, to protect her back. Right. I would consider a physical therapy or chiropractic or a combined approach and see if that doesn't take her pain away. Yeah. And then we'd go from there and see how things went. That might take care of her pain. I would probably give her a TENS unit. Okay. Help her with her back pain also.
There's no really risk for TENS unit, is there? No side
Not unless you're, right. I have a pacemaker patient. Yeah. Sometimes I say, talk to your cardiologist.
We even let them have TENS units, yeah.
Okay. And that's the main thing with that. And there's a theoretical risk if you have cancer that you probably shouldn't use a TENS unit.
Okay. So we want to make sure there's nothing terribly wrong. Okay, like a pinched nerve or something that's going to the leg. We want to maybe strengthen some muscles in case some muscles have been pulled during
probably
the
during pregnancy, the abdominal muscles become lax.
And then maybe some tension. I think that's a great place to start. So Chelsea, hopefully that will give you at least something to think about. It's never fun to have pain. And talking about babies, Michael Bell is married to Heidi, and Heidi just had baby Owen. and baby Owen's going to come on the show pretty soon. So Chelsea, I'm just glad you had a successful child, and hopefully the pain will go away soon so you can enjoy your new baby.
Exactly.
That'll be good. And we're going to introduce everyone to Owen pretty soon. As soon as his mom thinks he's old enough to join us, Owen's going to come out. We've got a lot of people that's interested in seeing what Owen looks like. This is another thing, is what are some of the causes of back pain? And this is a little bit different twist, Dr. Ford. It says, could it be from abuse in the past? So I guess that would be trauma, and I guess it's possible if they hurt the back.
I have patients, particularly female patients, and it continues to amaze me. They give me a history of abuse, mostly as a marriage type thing, and the husband pushes them downstairs or kicks them, and and that potentially can hurt your back, anywhere from causing a disc problem to potentially a fracture, or just crying pain. So I do see that.
Yeah. So I guess in that question, all the causes could be abuse. It could if you damage your back.
So that's a possibility.
And all the nerves come out of that spinal canal.
Exactly.
So any damage could cause it. One of the things I like to tell people to do is rest. See if it gets better on its own.
Yes.
But a lot of people, especially the guys, they keep going to work and have more and more pain. They start gulping down the goodies or whatever so they can work, and then they do more damage. So if you're having pain that won't go away, rest, see your doctor. Let's go to one of our texts, okay? And it says, for the last 4 months, I've had pain at the bottom of my feet, so foot pain. I've had some foot pain myself when I walk without shoes. So what could be some of the causes of the pain?
One of the common causes is plantar fasciitis, so the fascia connecting from the heel to the bottom of the foot there, to the forefoot. That's probably one of the more common causes of, and then you can also have heel pain from potentially a heel spur. So different kinds of causes of like for the bilateral foot pain like that.
Okay, let's go for another one here. This one is from a patient or a caller that's had chronic headaches and migraines. And they want to know, Dr. Ford, do you have anything that can help with this? Okay, so chronic migraines, headaches, how would you approach that? I guess we assume that they don't have anything organic wrong,
exactly,
like a tumor or a blood vessel abnormality. So how would you deal with
assuming
chronic
that there's
headaches?
no problem like that organically wrong? I like to get a nutrition history and see if they have any food allergy type things that could inflame and cause headaches.
Good, yeah.
Some different types of smells, perfumes, that type of thing, odors. Then if they've potentially also, if they have neck pain, it could cause headaches, and I'd consider maybe chiropractic or physical therapy to help that. If that doesn't help, then there's medicines we use. One of the common medicines that we use is Topamax.
Okay.
Topamax is really good. I've seen it be able to help a lot of headaches. And if they have a weight problem, a good side effect of Topamax, you can get up to 10% weight loss. In fact, they're putting in a new diet pill, Topamax, so you get a win-win if you have a weight problem. Then if you continue to have headaches, there's several other medicines we use. Triptans that are help. If you have a headache coming on, you take it to break the headache. You can repeat 2 of those. And if you still have intractable headaches, we also use some medicines like Lyrica and Neurontin to help control them. But the thing, after people have been on lots of medicines, the thing I use that's almost close to miracles we have is Botox.
Okay.
I had one patient that was on pain medicine, had to go to the ER once a week or so to get a pain medicine to intractable headache, migraines. She does Botox injections every 3 months, doesn't take any medicine at all.
Wow.
And she likes the cosmetic benefits also.
That is great. No, that's good. I mean, but so you don't do the advanced treatments until you've done the basics.
Exactly.
And a lot of people just want to jump to the advanced treatment before going through the basics for headache. Make sure there's nothing structurally wrong. Make sure the stress is good and not stress headaches. Hydration, going through the food. So I think that's a great approach. Mike, you're on with Dr. Dennis Ford. Go ahead with your question, Mike.
Yeah, actually, this might seem a bit out there, but I've been working on a theory of my own with a hypnotist, and what I want to know, it's hard to find collaboration on it, what I want to know is if you believe it's possible to stimulate rapid healing in the body with hypnosis.
Yeah. Well, I will tackle that one here. Okay. Mike, hypnosis and different types of alternative healings are out there a lot, and there's been reports of people having success with these. My concern with this is who is doing the healing, or what power or what mechanism can do the healing. like I say, I'm very leery of letting someone else take control of a mind. Okay, we know that evil forces can heal. Of course, God can heal. So that's my big concern is for hypnotic people. That they say that yes, they got well, but where's the power of the healing coming from? So I'm not an expert in hypnosis at all, but that was just my big concern about hypnosis, is that we don't know where the power, we don't know the mechanism, we don't know how it's happening. Some people have reported that they do get better, but how do they get better is the question, and that's a big question. So I appreciate your call, Mike. I know that didn't answer your question, but that's sort of my take on it today. Dennis, you have anything to add to that?
I'm not an expert in that area, so I couldn't give him an expert opinion on that. I wish I could,
but that's just our opinion, Mike. And just thank you for calling in. Okay, let's go to one of our text messages. It says in 2009. There was a cracked vertebra. This is from Johnny. So he cracked his vertebrae, and since he cracked his vertebrae, he's had headaches ever since. Any help? And I think you sort of talked a little bit about this with your last sort of thing. So cracked vertebra didn't help. And I assume we don't know where the vertebra was cracked. That would be very useful.
Yes.
So any advice for Johnny with cracked vertebra?
It depends on if he's still in a lot of pain at that site. It could cause headaches. It depends on what level. He might be a consideration for something called a vertebroplasty or kyphoplasty if it's below T5 on down to the lower back, where we put 2 little incisions and trocars and put a little cement in there, and it has a very high success rate of taking the pain away.
Okay, so that's something that you might consider. Thanks for your calls. They're coming in like crazy. We're going to get as many as we can this segment. We're talking about pain with Dr. Dennis Ford, hoping we can find something to give you a little bit relief in your life. Stay with us. We'll be right back.
The Heart of Health Live will return in just a moment.
Could it be this simple changed my life? What an amazing and solid yet fulfilling and liberating message Dr. Jennings provides. I loved it.
It is liberating. It frees your mind from all your mental turmoil and teaches you what is really going on.
This book is amazing and makes so much sense. It shows God as a God of love rather than an arbitrary, exacting God.
I am so grateful that a friend suggested I read Could It Be This Simple? It has helped me fine-tune my thinking. This book not only helps the mind to heal, but helps to liberate the emotions by bringing them into balance. You will be captivated with the case studies liberally sprinkled throughout this small, easy-to-read book. I dare you to read it.
Get your copy of Could It Be This Simple? A biblical model for healing the mind at Amazon.com or wherever books are sold.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We are talking about chronic pain with Dr. Dennis Ford, an expert in pain, and he's given us some great ideas. We've talked about Topamax and Botox. We've talked about trying to do the natural things first. Now we're on with Dot. Dot, what is your question for Dr. Ford? Dot, go ahead.
Well, first of all, I mentioned that I have been diagnosed with quite a shopping list, and I constantly have reoccurring pain in my lower back. I was diagnosed with lupus, fibromyalgia, chronic fatigue, so forth, and I'm allergic to a lot of pain medication.
Okay. Did you have a specific question, Dot?
I want to know why my back pain reoccurs.
Well, your back pain keeps coming on. Okay.
Yeah.
Well, you know, without examining you, we're probably not going to be able to give you a detailed discussion, but Dr. Ford can at least talk about some of the possibilities.
Okay, there's several things that we might consider. There again, would be core strengthening of your abdominal muscles, back muscles, weight loss if you're overweight. Because extra weight, I've had patients lose weight and their back pain starts going away. And basically, the exercises, gentle stretches, anything like that to help decrease back pain.
Okay, so those are some things that might help. Also, you know, see your doctor and make
sure. That I found that really helped me with, you know, I can't really do exercise because chronic fatigue and the fibromyalgia hurts me bad. So I do deep water aerobics.
Super. Good. Yeah, I've heard water helps a lot of people, Dot. Okay. Do you practice deep breathing and spiritual things as well? Does that seem to help?
I do the best I can to live in the spirit and not in the flesh. It kind of keeps the pain away.
You know, Dot, have they ever tried a TENS unit or nerve stimulator? Sometimes that helps a lot too. Have they tried that on you?
No.
Because that might be a possibility too, because that doesn't have a lot of side effects like some of the medicines do.
Perfect. Another thing you might consider, if you haven't tried, there's several different kind of topical creams you can put on. They're not absorbed systemically, it's localized to the back, that are anti-inflammatory agents, and sometimes they work great.
Okay. Well, I hope that gives you
The
at
only
least...
one that I've found that works really well is Watkins liniment.
Okay. Okay. Well, Dot, we will say a prayer for you, and we know this is a hard problem, but you know we'll be praying for you and hope something out there will at least give you a little hope there. Okay. Thanks for calling. Our next caller is Jim, and Jim's calling us from Oregon. Go ahead, Jim. You're on with Dr. Ford. Jim?
Hi there. I'm a 78-year-old, very active male, and I suffered a hip fracture in January of this year, fell on the ice, and it was in the neck of the femur, and they opted to replace it with a titanium ball, and they left the socket as it was. And so I've been in recovery therapy since then, and have been slowly getting back to work. We have a small farm, and we raise vegetables and eggs and what have you. And I have quite a bit of pain. And on my 5-month checkup, the doctor told me that if the pain didn't get better, that he would opt to go in 6 months and replace a socket with an artificial socket. And this kind of turns me off. The whole idea of it does. At the present time, I have put in about 4 hours in the garden today, and I'm not in pain that I can't stand. I did take 2 leave this morning. But you know, I'd like to be without the pain, but as I said, I'm able to stand it, and I just wanted to know if you had any suggestions that might help. Now, how you would feel about a artificial socket replacement, or opt to leave it as it is and work with what I've got. I understand that limits mobility quite a bit, and I'm able to bend, and I'm able to get down on my knees, or you know, do just about anything I've got to do with some limitation. And right at the present time, I do have a not an ultrasound, but a laser, low laser. I forget what they call them now. But anyhow, I bought it through a chiropractor, and supposedly it's supposed to be the latest thing in sports medicine in this country.
Is that helping?
So it seems to help some, yeah.
Okay, I guess what I would think is, if that helps, I'd keep doing that. But if it depends on how much pain you're in. If you're in a lot of pain, I would consider the replacement, the socket replacement. One of my best friends, who's my patient, he took his pain away tremendously. He's a real estate agent. He works 12, 14 hours a day. He's doing super with the socket replacement. There again, if I'm in your situation, it depends on the pain, how much you can tolerate, and if you had enough, then I would consider taking the risk to do the surgery.
Well, Jim, I think that's pretty straightforward. It's according to how much pain you're in. But thank you for calling, and we'll say a prayer for you. Hope you get better soon, and regardless of the decision. And it's all about risk and benefits. Which is riskier, the surgery or the pain? Is it going to hurt you long term or short term? Are you losing mobility? Is the pain causing other problems like blood pressure, raising the risk of heart disease? So Jim, this is a little bit of a complex decision. So I guess if you're having pain really, and they can't get it to go away, I think the socket, because you don't want to have pain the rest of your life. Usually it gets worse if you can't get at the cause. So thank you for your call. Okay. Our next caller is from Gordon. Gordon, you're on with Dr. Ford. Go ahead, Gordon.
All right. I like that. I'm going to know about herbal herbs and stuff that can help with pain, stuff like that. On people with fibromyalgia, any kind of problems in the body, maybe like epilepsy or anything. And are you willing to work with the herbal things?
Okay, so
instead of medication.
So herbs to help pain, is that what you're saying, Gordon?
Yes.
Okay, are there some herbal or natural substances that help pain? I can think of a few, like you've heard of aloe vera creams.
Yes.
Sometimes those aloe vera helps some topical pains. There's some things that we use medically that have, herbal supplements in them.
Right. It depends on, if it's pretty severe pain, they usually don't do much. But it's worth trying. I'm not familiar with really a lot of success with them, but I'm always open-minded. I'm always looking for answers, and I try and see.
Yeah, and we're not herbalists, but the ones that I've seen help some people is the aloe vera creams can help a little bit. Sometimes it's really depending on what the pain's coming from. If it's coming from a toxin or something, sometimes charcoal poultices can pull the toxins out. The nerve pains are a lot tougher, and that's usually the cause of chronic pain related to nerves. Sometimes that's very hard, Gordon, but I would look into all your options, and this is one of them. And we just want to thank you for calling us, okay? Now, in our next section, Dr. Ford, we're going to talk about aging, okay? There's a question that's come in here that has to do with someone with arthritis, but she also wants to know about the aging process. So we're going to get that after break, because a lot of us, including myself, wants to know everything we can do to sort of slow down aging. My son and I did a report on oxidation and how oxidation makes aging, and things that cause oxidation are like cigarettes, that makes you age quicker, lots of things like that. So we're going to talk about aging. You can still join our conversation. 855-644-3278 is our phone number. Our texting number is 423-834-7307. We're learning about chronic pain. We're just making suggestions with Dr. Dennis Ford. Of course, you need to see your own private doctor for definitive treatment, but we just want to give some hope out there, give some different options about things you might ask your doctor about. So stay with us. You're watching Heart of Health Live.
Heart of Health Live will return in just a moment.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. heartwiseministries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
Heartwise Ministries and these adorable sheep. Want to remind you that every Thursday at 6 p.m. Eastern, the Heart of Health Live is all new with an exciting guest. That's 6 p.m. right here on this station.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Our exciting guest this week is Dr. Dennis Ford, and this is a segment we want to talk about aging. Sometimes we get so busy talking about chronic pain that we don't talk about other aspects, but we want to talk about aging. We're going to initiate this segment by a text that came in from Robin. And Dr. Ford, this is Robin. She says, hello, my name is Robin, and I have osteoarthritis in both my hands and degenerative disc disease. My hands hurt most all the time, especially when I'm doing repetitive motion. I'm already taking diclofenac, and short of surgery, what are some of the things that I could do to alleviate the pain? So we're going to talk about that. And then she wants to know about things that can slow down aging process. So let's talk about some of the things she might do to help the pain in her hands and the disc, and then we'll talk about aging. But before we do that, you talked about something you thought about from our caller that asked in about pain.
This was not an herbal, but it's something natural I really like with chronic pain. I learned from a famous pain specialist in Texas. He uses magnesium oil, and I've started using it. We're all deficient in magnesium, and it's needed for about 300 enzymatic reactions in our body. Helps vasodilate the arteries, and relaxes muscle. And so you spray it on, because we're all deficient. It's not in the foods anymore. I mean, it's way down in the foods from what it was years ago. And so it helped. I spray it on my body, and just to help relieve. It helps with my back pain when I have it sometimes. Helps relieve the muscle spasms. Yeah. And I think it's an option that a lot of people really should consider.
And there's really not a lot of risk for that, is there?
No, it's very safe, and we're deficient in it. And it's so a great way to get magnesium. You absorb it transdermally.
Now, we want to talk a little bit about, we had disc disease, and we have a lot of chronic pain in the hands that won't go away. We've mentioned a lot of these things already that can help her. So let's sort of talk about some of those things that can help.
Okay, if I have pain in my hands, she's already on the diclofenac by mouth.
Right.
There's diclofenac cream. There's several different brands. One I like is it's called Pinsed. And it's got DMSO in it, what they use in horses to help take their pain away. It's the first one approved for humans. And mixed with diclofenac, you rub it in it, and it helps relieve pain. One of my patients had a heel pain, and she'd been having it for several months. Put it on, within a few hours, she came back and said, actually it was my daughter, said, Dad, my pain's gone. And I use a lot of patients. I had a problem with my foot, and I put it on, and it takes the pain away. And you don't absorb much of it systemically to hurt your stomach, kidneys, liver.
So it works inflammatory.
Yes.
Right. So it's anti-inflammatory. Probably might even get there more effective because sometimes the bloodstream can't get to where the nerve endings are.
And the DMSO helps absorb it faster locally wherever the spot, and there are a few rub it, and there are a few drops in your hand. It's really technically approved on the knees, what they did the studies on with the FDA. But wherever you're hurt, it's something that's safe to use to help decrease pain.
Diclofenac cream.
It's Pinsed. There's one brand with the DMSO, and then there's another one. It's Relafin. There's another one. It's a cream you can rub in.
Wow, that's great.
Yeah.
Now let's talk about aging.
Okay.
No one wants to get older. We know that some of it's genetics. We know that people that don't smoke cigarettes don't antioxidants help. What are some of the what's your approach to some of these anti-aging mechanisms that are out there?
Okay. Well, first of all, the reason my goal is to live to your full extent, to your full capabilities until you die. Okay. Typically we kind of go like this. Anti-aging, we like to decrease the slope, and when you die, or Jesus comes and it's all over with. Either way, So that's my philosophy, and that's why anti-aging doctor. You want to be up on top of your game mentally and physically, spiritually till you die. So now your other questions were the mechanisms.
What are some of the things you do to help in the aging?
Okay.
Someone comes to you and say, "Listen, I'm aging." What are some of the things?
I always start off with nutrition. The father of medicine, Hippocrates, in 2,400 years ago, 400 years before Christ, he said, "Let food be your medicine, medicine be your food."
Okay.
He was right. I mean, you eat your fruits and vegetables and some protein. If you're vegetarian, beans and legumes. If you're not vegetarian, low-fat meats and types of things like that. Try to eat healthy. Try to avoid junk carbs.
Okay.
That's number one. He was right. You fix that and get your diet right, a lot of things get better.
And the studies have shown that the antioxidants, the substances we get helps reverse this aging process, oxidation. So that's
exactly
great. So food.
Number one, and then number two, probably a good multivitamin. If I could, I'm a big vitamin nut. I love to take things where I don't have to be on medicines.
Right.
If I was stuck on an island and they said, "Okay, you can only have one vitamin," what's it going to be? It's vitamin D3.
D3.
The reason is decreases up to 16 kind of cancer risk. The levels go 30 to 100. If you get your level around 85, in women, breast cancer risk go down by 85%.
Wow.
Prostate cancer, lung cancer, colon cancer, MS goes down, the higher your D levels are. It's cheap. Mm-hmm. What can you say? Your immune system boosts up. 2,000 genes are upregulated for the good of our genetic genome. So to me, it is a no-brainer. Boost your immune system where you don't get colds, flus as frequently. Less downtime. There again, you're on top of your game mentally and physically.
So food, vitamin D3. Anything else?
Okay, then typically a good multivitamin, just a good brand multivitamin to kind of cover your B complex and just your different things. And then I could talk an whole hour on this subject because I'm a fanatic. I love it because I want to feel good. I don't have any medical problems and I want to keep it that way.
So we want to get the main exercise.
Exercise is important. It's great too. Walking, and then maybe you can build up. Weight strength training is good because as we age, we lose muscle mass and gain fat.
Right.
We need to reverse that to keep young. Cardiovascular, walking is good. You're the expert here, but now I've done a lot of research in this area also. You can build up to I used to run marathons. Stop doing that now. I'm doing high-intensive interval training.
I agree with you.
Okay, I do it in 20 minutes, 30 seconds as hard as I can go. Get my heart rate up to 150 to 170, somewhere for me, my age. Then get my breath back a minute and a half. And I do that 8 times. Raises growth hormone. Mm-hmm. Helps it just increase your cardiac capacity, lung capacity. And I've seen a lot of research behind this. I was doing marathons and spending 3 and 4 hours on weekends running, hurting myself. Yeah. Too much oxidation, as you're referring to, too much damage to my body.
Right. So those are some great suggestions. Now, what do you think about some of these anti-aging things that mainly fix the skin? You hear about Botox injections and that kind of stuff. What do you feel about that?
I mean, it depends. I mean, if you feel good inside, whether you're taking care of yourself, some people want to feel good on the outside. I know some people say that's vain. Well, whatever floats your boat. You know, there's several things. There's different kinds of. There's one thing. It's pycnogyl. It's from pine bark. You can rub a pycnogyl cream. And it's natural. It helps increase the skin volume. There's different things you can do. It just depends on your attitude about that. I think it's okay.
Yeah, okay. Well, we got a quick one here. This is from Keisha. She's begun experiencing a case of pain. It comes 1 week before menstruation, and it began 3 months after the birth of my child, which was also a cesarean section. But this pain has intensity of gas pain and menstrual cramps combined. It affects the right side of my body. Do you have any input on that? So she's having some pains after she gave birth, after her menstrual periods. So
how old is the baby? Does she have give information?
It looks 3 months after the birth of my child when she started having the pain. Do you have input on that? It's below my rib cage, and sometimes she says it moves to her knee. I've had it for a year now. My doctor can't find anything wrong, and yet she's in severe pain. So any suggestions? We only have a few seconds so we get this one. Boy, that's a tough one.
That is a very complicated, tough one. I don't know what to tell her really on that one.
It doesn't follow any real pattern that I know. It seems to have something to do with her periods, though.
It does, doesn't it? It depends on how heavy her menstrual periods are.
Yeah.
Because I do a lot of bioidentical hormones as an anti-aging thing. And it depends on her age also, and if she's having heavy menstrual periods. You'd have to do some blood work testing to see if there's a problem with that, or if she's having possibly endometriosis. I'm not OB/GYN there. That might be a...
And I would have my obstetrics gynecologist take a look. I think that's where I would start for this one. Zena, don't go away. We're going to be right back, but we have to stop for a short break. We're on with Dennis Ford. We're going to come back with Zena after this short pause.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. We're so thankful that Dr. Ford has volunteered to give his time. And I told him before we got on today that when you serve others by answering questions or helping them in whatever way we can, it also helps our own chemistry. So all those out there that suffer from chronic pain, I encourage you also to help others, because that can also improve your chemistry. And you've helped others by calling in with your questions, because someone else might have the same problem. Maybe one of these things that we've talked about might help. And if nothing else, we know that there's hope in that relationship we have with God. We lost Zena. She hung up. But Gina, we encourage you. I'm sorry you had to wait so long. We're not going to get to everyone's call tonight, but we have an anonymous caller from, I think, Knoxville. Go ahead with your call. We're on with Dr. Dennis Ford.
Thank you for answering my call. My question is that I'm a mother of two, and my first baby was just a natural birth. But then the second baby, I asked for an epidural, and it seemed to me that ever since I've had my second baby, I have this back pain that if I do a lot of bending over stuff, it hurts. And but so I've been taught the right technique, bending and stuff, but. Here recently, maybe just a week or two, I've been having this pressure in my head that when it comes, it's really severe and really irritating, and then it goes away, and it seemed to start just right where I got the epidural shot. Would that be the reason for the pain, or am I just thinking that it is?
How long ago was your baby born?
My baby is a 3-year-old now.
3 years old?
Yeah.
I don't think so, but occasionally I've heard a mother can say that to me, that she felt like that caused her pain. But we do epidurals to treat back pain. So it's a tough call. I don't think so, but I'm not going to rule that out. But I don't think so.
Yeah, that's a tough. What do your doctors think the pain's coming from?
Well, I haven't gone to any doctor, so I don't take anything really. It's just that previously I realized that when I bend the wrong way, when I don't use my knees to bend, then it hurts, and it seems to be just right there where I got the epidural shot. But what concerns me now is the pressure in my head that comes and goes, and it just started recently, so I can't say for sure what triggers it or why it happens. But then it does go away after I do some. I stretch my neck. It goes away, but I never know when it's going to come. It just comes on me suddenly. I don't know if it's related to that epidural that I had when I had my baby.
That's tough, but it sounds like Dr. Ford, for sure, she needs a complete exam and evaluation.
I would, just to rule out any other type of problems.
This is something that needs a complete evaluation by your doctor. You might want to order some tests to see if there's other things going on, because this sounds a little bit complex.
It does.
One thing leads to another. So we just wish you the best of luck. Wish we could answer that one on the phone, but I would want to steer you back to a doctor for a complete evaluation. We're all out of time. We're going to have Dr. Ford on again. We're going to talk some more next time he's here about bioidentical hormones and all those things. And we want to thank you for your call. And hopefully we've helped someone out tonight on Heart of Health Live. Thanks for your support. We'll be praying for you. Join us next week on Heart of Health Live.